Good afternoon. My name is Julene Johnson, and I'm a professor at the University of California, San Francisco. And I'm joined by Dr. Melita Belgrave, who's also a professor at the Arizona State University. And we are here today to talk about the Music Network's Pilot Grant Research Program, and specifically the program for the Music and Dementia Research Network. So this is just a recap of who we are and where we come from. And I wanted to acknowledge the National Institute on Aging as provided funding for this cooperative agreement, the U24 mechanism, which has allowed us to create a music and dementia research network. So really glad you're here. As one of the logistics, we encourage you to please type any question you have into the Q&A button on the bottom of your Zoom. And we will try to get to as many of the questions as we can today in this hour. We're going to leave time at the end for questions. But if for some reason we don't get to your question, we're going to be creating an FAQ, or a frequently asked questions document, that we'll upload to the MDRN website. And if your answer doesn't get addressed then today, you can again look at the website and check it out to see if we answered it there. And if not, you're welcome to contact Julian Silva, who is the project manager for our research network, as his email will be at the very end if you have any additional questions. So here is our Music and Dementia Research Network. Collaborators Melita, also Jose Pepe Contreras Vidal, who is a biomedical and neural engineer at the University of Houston. And also joining me at UCSF is statistician Dr. Jing Cheng. If you all want to get to the website quickly, there's the QR code. Feel free to check out the website. And importantly, please create a directory profile on the website. And this is free, and it doesn't take much time to do it. But we'd love to know about who is interested in music and dementia. Broadly speaking, and we consider researchers, clinicians, community-based organizations, students, whoever you may be that has an interest in using music in the context of people living with Alzheimer's disease and related dementias. Please join our directory. And there's the website link above. So for today, I want to give you an overview of what we're going to be doing. So this slide here shows the topics. I'm going to first give you an overview of the NIH Music Network's pilot research program. Then I'll go into a little bit about the background and the purpose of this and the context in which these were funded. I'll talk about high priority research areas that are specific to our Music and Dementia Research Network, and then drill down into some of the details, talking about eligibility and the requirement that these pilot grant applications are mechanistic, and also they have to involve multidisciplinary teams. And we'll talk a little bit about that, the evaluation criteria, how the pilots are reviewed and selected, and then talk about the sections that you'll be submitting, such as the budget and the actual application itself. And then we'll leave time for Q&A. Again, please type any questions you might have in the Q&A button on the bottom of your Zoom. All right, let's get started. So our music research networks actually evolved out of what is called the Sound Health Initiative. And this saw its beginning in a transformative partnership that developed between the National Institute of Health, the Kennedy Center for Performing Arts, and Renee Fleming. And the NEA, or the National Endowment for the Arts, also had been funding research labs since 2011, and several of these research labs focus on music and health. But it wasn't until a chance meeting in 2015 between Renee Fleming and Dr. Francis Collins, the then director of the NIH, that this transformative partnership, or the Sound Health Initiative, came to life. In 2017, a panel of 25 experts were convened at the NIH to discuss the current state of research on music and health. And this panel generated research recommendations to accelerate the study of music's effect on the brain and the implications for human health. And this workshop resulted in an article that was published in Neuron in 2018 about music and the brain. And the NIH offered research funding subsequently for the multiple initiatives that followed this. It was a really exciting time for us who've been doing music and aging research for many years, that this really gave the initiative some legs, as they say. So one of the recommendations from this meeting, and which is published in Neuron, was that there build the capacity to an infrastructure to help fund and promote mechanistic studies about the impact of music on health. And these networks are also working on frameworks and terminology and taxonomy, but this is exactly where our U24 mechanism was recommended. And you could read more about that in the Neuron paper if you like. So here are the 4 networks. Our Music and Dementia Research Network is the only research network that focused on music in the context of Alzheimer's disease and related dementias. And the other 3 networks focus on music for pain. All 4 networks are adopting consistent terminology and taxonomy and supporting multidisciplinary collaborations and initiating 1-year pilot projects to test novel mechanistic hypotheses. So the National Institute on Aging funded our Music and Dementia Research Network, and the National Center for Complementary and Integrative Health, with co-funding from the NIH's Office of Behavioral and Social Sciences Research, and the National Endowment for the Arts, helped fund the additional 3 pain research networks. So the Music for Pain Ensemble and Audio Analgesia. So check out their websites too. But again, our Music and Dementia Network is the only one that focuses on music in the context of Alzheimer's disease and related dementias. So what is the purpose of our pilot research program? So the webinar today just focuses on the pilot research program from the Music and Dementia Research Network. And the purpose of our 2025 RFA is to elicit 1-year mechanistic pilot studies to generate the necessary preliminary data that would further strengthen future NIH applications for later stage studies on mechanisms by which music may have a positive impact on health in the context of Alzheimer's disease and related dementias. These pilot studies will also facilitate multidisciplinary collaborations, for example, among neuroscientists, music therapists, musicians, music educators, biomedical, behavioral, and social scientists, etc. These are just some examples of the multidisciplinary team that you will be required to pull together on your application. And again, I want to emphasize that only mechanistic studies, including mechanistic clinical trials, are eligible for this RFA. And studies that are designed to demonstrate efficacy or effectiveness of music-based interventions are not eligible and should be submitted under the appropriate National Institute on Aging clinical trial call for applications. And if you want to learn more about what we mean by mechanistic, you're welcome to check out some resources on our website. And we will soon have some additional videos up that will help give you some more information. So what do we mean by music-based interventions? Well, as you know, MBIs have been investigated for efficacy in the reduction of symptoms related to dementia. However, when and how music may influence dementia is unclear. And little is known about the mechanisms underlying the effects of these music-based interventions. And here are some examples of and definitions of music-based interventions. You don't have to use these definitions, but please consider taking a look. And importantly, there were just two recent publications that will help you think about how you define your music-based intervention and what sorts of parameters are important to document. And these are published by Sherry Robb and colleagues, and they're referred to as reporting guidelines. So this may also help you as you start to think about what aspects of a music-based intervention you might want to think about. So the scientific scope of these pilot projects is limited to some high priority research areas. And these research areas were suggested by the National Institute on Aging. So we essentially went to the original RFA from the NIA and talked about and articulated the types of research areas that we're interested in. And the first research area, and again, you don't have to address both of these research areas, but these are the priorities of pilots that we're looking for. So for research area 1, which is mechanisms and biomarkers, we're looking for pilots that are exploring innovative mechanistic hypotheses of the neural systems involved in therapeutic effects of music. In the context of dementia. There's some examples of what those areas might be, such as whether you're thinking about motor or cognitive or affective aspects. A second area underneath this research area 1 is examining non-neural physiological systems in novel measures, such as the impact on non-neural organs or biochemical and molecular signals, or some sort of epigenetic modifications that are relevant to music-based interventions in the context of dementia. Another area of interest is investigations of more psychological, behavioral, and social factors related to the effects of music. Again, not limited to thinking about predictors or moderators and mediators of those treatment effects that you might be studying. Another area under this focus, high priority area, is the discovery of treatment responses or predictive biomarkers or signatures for music, again, in the context of dementia. And all of these, this text is in the RFA that we have posted on our website. So I know this is a lot of the actual reading of the text here, but be sure to make sure that one of your pilots overlaps, broadly speaking, with one of two of these research areas. And then for research area 2, which is technologies, tools, and models, we're interested in applications that focus on the development and/or testing of innovative animal models to study mechanisms and biomarkers of music, again, in the context of Alzheimer's disease and related dementias, or the development and/or testing of novel technologies to measure how music impact brain or body, or to monitor health-related responses. Again, we have an additional research priorities that a subset of the folks who met in the May 2024 Music, Dementia, and Brain Research Summit in Washington, D.C. We also have those research priorities on the MDRN website. So there's some additional considerations to think about. So our MDRN has an interest in using mobile brain imaging technologies through its collaboration with the National Science Foundation funded Brain Center. And the Brain Center, with our collaboration with the Pepe Contreras Vidal, will provide access to the MOBI equipment, software, AI, algorithms, and expertise if for a pilot that's funded by our research network. And the technical support can also be provided, but the cost, such as travel to the site for training, supplies, etc., with this collaboration must be budgeted in the pilot. And importantly, depending on the level of contribution of brain, some pilots would require collaboration, while others only technical support. So please reach out to the Music and Dementia Research Network as appropriate. Also to consider, the National Institute on Aging utilizes the NIH stage model for intervention development and the science of behavior change as frameworks for behavioral intervention development. And the NIA is especially interested in stage 1 studies that focus on testing the mechanisms through which music-based interventions may achieve their effects. This would be consistent with the NIH Science of Behavior Change. Again, emphasis on mechanisms of change. And links to this information about the stage model and the SOBC framework are on our website. Please take a look. And another publication of interest is an article that was published by Emmeline Edwards and colleagues in Neurology in 2023, where they talk specifically about what are the common data elements and the building blocks of music-based interventions, and thinking about some core set of functional outcomes, measures, and biomarkers. So this is another resource for you to tap into for more information about what you might be proposing. So I want to just pause here and say, invite my colleague, Melita, do you have anything that you want to add? I'm going to jump into the eligibility next, but anything with regards to the background or resources that may be helpful?
I don't at this time. I just want to say that we're really excited to see people with us on the webinar, and we really are hoping that you will think about submitting an application because we're really excited, and joining the network if you're not already a member of the of our cohort.
Thanks, Melita. Yes, and please feel free to jump in if you want to add anything. Okay, so now I'm going to switch to thinking about some of the nuts and bolts. So first I want to start with eligibility. And we often get most of the questions around eligibility, and hopefully we can answer them today. If not, again, we will have an FAQ document that we'll upload to the website. So to be eligible to apply, you have to identify as a research scholar that's affiliated with an accredited university or medical center that has the capacity to submit NIH grants in the United States. Unfortunately, we are not allowed to send pilot funds outside of the United States with this small mechanism that we're working on. We just don't have the capacity to do that through our university. Also, we encourage early stage investigators to apply and postdoctoral scholars. But if you're a postdoc, we ask that you include a letter of support from a faculty mentor. Unfortunately, doctoral students or medical students are not eligible for this mechanism. But again, we encourage early stage investigators and postdocs to consider applying. Pilot applications also must come from multidisciplinary teams. And this means that at minimum, there's going to be 2 investigators who represent different disciplines to be a multidisciplinary team. So in other words, you will not be eligible if there's just one sole principal investigator on your pilot. And Melita, did you want to talk a little bit about the types of multidisciplinary teams that could work in this context?
Yeah, I think the variety, the better. I think one of the things that excites me about getting to be part of the network is getting to work with others who aren't just like me as a music therapist, getting to work with neuroscientists, getting to work with people who specialize in the technology, because it's really neat to see how we all come at a problem together with all of our different lenses and our different hats. So I would just say be really creative in who's on your team and really think about this is the one time that we really, really, really want you to address a problem from multiple lenses.
Yeah, and other partners also might be community-based organizations. So
Yeah.
you might be a researcher and you might have a community-based organization that you want to collaborate with and do more applied mechanistic work, but these are the different types of teams.
And I'm excited to see that the chat is going wild, which is great. We have three whole questions in the chat, but Julian's been answering some things. But we have someone who is saying, thank you for saying really that it's a multi-background because their background is in nursing. So yes, find a music
Yes.
person and get on in there. We want to see your application. Yeah, so I think it's good.
Yeah, and nursing is another great example. And you might be a nursing researcher that's at a university. And one thing to think about, you might have experience in music, but if you don't, think about how might you collaborate with somebody, whether they're a musicologist, a musician, a music therapist, to make sure that this is a multidisciplinary type of pilot.
And I was going to say the cold calls really work. I know for myself, I've gotten on people's grants when it's that same thing. I have to do a multimodal project and I need someone with the music expertise and aging, and they come across me. And then it's the beginning of a beautiful new friendship and communication and research partnership. So I encourage y'all to get creative with who joins your team. You don't have to already know them in depthly and worked with them before.
That's a really good point, Melita. And also, it's important to have some expertise in dementia and aging, right? So these pilots are, they're not the largest budget in the world. And so you're going to have to get creative about how you think about what resources and scholars and experts in this space that you might want to pull together on your team. And this is our second call for grants, pilot grants, and we hopefully will have at least an additional 2 more calls in the future. So if for some reason you don't feel like you're ready for this round, stay tuned for next year. Okay, so we also really appreciate all the applicants as to register as a member of the Music and Dementia Research Network by the time you submit your pilot grant. Again, it's no cost to you. It's free. It's easy to do. You can share as much or as little information that you want. But this also puts you on our listserv to get information about what's upcoming. We also do webinars, and we have those webinars stored on our website. In fact, Melita did the last webinar. What was the title of your webinar, Melita?
Oh, it was a long, fun one, but it was all about centering belonging using music for older adults, especially with older adults with dementia, and just being able to think about how we welcome, how we enter, how we provide space using music as our cue to center older adults, and especially when they were having cognitive declines as well.
Yeah, it's a great webinar, and it's also on our YouTube, Music and Dementia Research Network YouTube page. So you can watch, I think we also have a technology webinar, and I did just a brief overview of music and dementia and brain. So feel free to check out those resources too. Okay, so we've talked a lot about multidisciplinary teams, and so I won't spend a lot of time here. But also think about the roles of each person who's going to be on your pilot grant. So the principal investigator is the person who will lead the project. So they have to have enough experience, to be able to lead a project or to convince, as a postdoc, perhaps with a mentor, that you're able to lead the project successfully. You might decide to have co-investigators who will contribute significantly to the project, and compare that to consultants who might offer more like guidance and advice, but don't kind of rise to the significant contributor stage. We're going to ask you for bio sketches for the key personnel. So you're going to you want to think about who are those key players on your pilot. So the funding, that's the $1 million question. And each pilot project may request up to $50,000 in modular increments of $25,000. It is possible to go over $50,000, but you must obtain prior approval from our team. So from Melita, myself, and Pepe. Also, it's important to know that indirect costs from your institution and publication costs are not allowable on this small pilot mechanism. So make sure you check in with your academic institution and make sure that that is okay with you applying for this grant mechanism. So here are the evaluation criteria that we are going to use along with a panel of reviewers, which I'll talk to you about in just a minute. And we'll use these criteria to evaluate each of the pilots. So for significance in innovation, we will ask, does this pilot study address an important problem or barrier to progress related to mechanistic studies in the context of dementia? Specifically for the innovation part, does the proposal include novel concepts, approaches, or methods that will advance knowledge? For the investigators, does the principal investigator and co-investigators have the background necessary to complete the project? And again, importantly, does it involve collaborators from multiple disciplines? Does the principal investigator have expertise needed to lead the proposal? And we talked about that on the prior slide too. For the approach, are the overall method, study design, analyses, or planned activities appropriate? And importantly, can this be done in a 1-year time frame for a pilot? That's always one of the tension points. And then for the environment, we ask questions such as, will the environment in which the study will be done contribute to the probability of success? And do you have institutional support, equipment, and other physical resources available that are adequate? And importantly, this is really meant to be a stepping stone to the next grant that you submit. And we're very interested in the future potential of your project to get additional external funding, such as from the National Institute on Health. Okay, so that's all of this is defined and outlined in the RFA that we have on our website. So if you want to learn more about each of these areas, feel free to look at that again. And then we have a review process and a selection process, and the applications will be reviewed by experts in music and dementia. And the selection of the projects will be made in consultation with our music and dementia research leadership team, so Melita, myself, and Pepe. Also the National Institute on Aging project scientists, and it must be approved by the NIA program officers. So as you can see, it's a multi-step process, and we do reach out to our colleagues. And if you've been a reviewer, thank you very much. It was a great process during our first round. I want to thank you for your service on that. And also, if you're selected, the NIH is going to require you to have to conform to their research funding requirements, such as creating a clinical trials study record, etc. You don't have to do that for the pilots, but if you are selected, there'll be one more step to get that compliance stuff into the NIA. And of course, we'll request a pilot final report at the end of your pilot. Anything else to, yeah, go ahead, Melita.
I was thinking if it was okay for us to pause and answer just a few of the questions that came up in the chat. Because I think they were related earlier as you've been going into the nitty-gritty
Okay.
of the proposal. And the first one is, can a non-US citizen postdoc at a US institution serve as a PI on a grant application along with having their mentor's letter?
Thank you for that question. If you have an appointment at an institution in the United States, so if you're an assistant professor or a postdoc, we don't take into consideration that whether you're an international scholar or an American scholar, but you have to be at an American institution, a university or medical center that can accept NIH grants. Hopefully that answered your question.
Thank you, thank you. And then this one is about budget.
Mm-hmm.
That is when working out the budget and wanting to potentially pay some of the collaborators, is it okay to do honorariums for the musicians involved in the project as they're working out their pilot budget?
When there were, so the musicians would be either a co-investigator or a consultant. Is that how I'm interpreting that?
That's how I was interpreting it. Maybe it's a consultant.
Yes, absolutely. And of course, I have a budget slide that's coming up here. An important thing is you want to justify the work that they're going to be doing. Absolutely, though. Yes.
Great. And the final one is on technology. Can you use a music app? And I think we may need a few more information there. Like, is the music app the part of the intervention? Maybe tell us a little bit more, and then we can answer this question probably. And we also don't have to answer it here. You can always email any of us on the investigator team, and we can get into a longer conversation about that. But just wanted to acknowledge that question.
Yeah,
As
thanks.
the intervention, yes, a music app is the intervention.
Yes, absolutely. That's technology. That's great.
And
Again, it has to be in the context of a mechanistic study, though, right? So trying to use this music app to study the mechanisms by which music might have an effect. So we just can't look at the effects of an app. It has to be really understanding the underlying mechanisms. So here are the proposal sections in addition to the review criteria that I talked about. There'll be one page specific aims. So we have a summary of what that project looks like. And if that's a new term, feel free to Google it on the web and see if there's some examples of what a specific aims page looks like. Also, the literature cited will not be included in the page limit of just 6 pages. So that's the maximum page limit for the sections between specific aims all the way down to the potential. And we have some recommendations for how long each of those sections should be in the RFA, the request for applications. And then, of course, if you could have a maximum of 2 one-page letters of support. So if you're a postdoc, one of those letters of support should be from your mentor, in other words. But they're not required, but again, it's not included in the 6-page limit that you have to fit your specific aims all the way down to your potential for future NIH funding. Again, the NIH BioSketch, and we have an example on this on our website, I believe, and if not, we can get one there for all key personnel, and then the budget and budget justification. And importantly, a letter of intent is not required, so we're not going to solicit that ahead of time, but we will ask you to submit the application as a single PDF to a secure Qualtrics link, which is on our MDRN website. And that PDF will be all the sections 1, 2, 3, 4, including the cover page. Okay. Here's a little bit more about the budget. So the budget has to be modular in increments of $25,000. Again, as we talked, the budget cannot exceed $50,000 without prior approval. And the expenses may include salary and fringe benefits for the PI, the co-investigators, the research staff. And so your musicians may be considered research staff. I don't know. They could be maybe your partners, research supplies, and participant payments. Project-related travel expenses are allowed, but must occur during this 1-year pilot. And as I mentioned earlier, institutional indirect costs and publication costs are not allowed. And the budgets will need to be approved by the NIH if you're selected for funding. So hopefully that's the nitty-gritty and the budgets, but we can certainly answer more questions later. And here is the timeline. So we announced the call for proposals in beginning of August. Today is our webinar, and we are expecting to have everybody's proposals by November 17th, 2025. And again, if that's too soon for you all, stay tuned. We hope to have another round next year. And the funding decisions we anticipate will be around the summer of 2026. Some of this depends on the review process, the selection process, and making sure that we, as I mentioned, the NIH has to also approve the announcement. So it's somewhat of a long process, but so just be patient with us. But we anticipate the summer of 2026 being potentially when the pilots can start, but this is not a guarantee because there's so many steps after you submit your proposal. Okay, for more questions and contact, please only use the MDRN at ucsf.edu email for your questions. We want them all to come through just one portal. Julian Silva, project manager, who's on the call webinar today, will start and kind of direct those questions to the right person. Again, here's a QR code to get to the website to create a profile. And once again, we thank the National Institute on Aging for supporting our cooperative agreement. And now we'd like to take questions. Again, please type your questions in the Q&A on the bottom of your screen, and we hope that we can answer everything today. So thank you again for being here. And Melita, it's always an honor to work with you. So really great.
I know I feel
All
like
right.
I'm on a little talk show today. It's been fun. Question from the community, right?
Yes. And Julian, feel free to come on camera and help us with Q&A if you'd like.
Sure, we do have a question. Can you give us one or two examples of an acceptable mechanistic hypothesis?
Well, that's a good question. Okay, I'll give you an example. And again, we will have on our website some videos, actually some of a webinar that's done by the Roybal Center at the University of Minnesota that really lays out this idea of how you set up a mechanistic framework and test mediator moderators and how you might set that up. But I'll give you my example. I currently have an R61, R33, an intervention development grant that's focused on a piano improvisation training intervention. We are testing the hypothesis that participating in a music-based intervention, this piano training for 12 weeks, actually affects a mechanism called self-regulation, which in turn will increase cognitive activity. So as older adults living with mild cognitive impairment age, they might decrease their activity in meaningful and challenging cognitive activities. So we're testing the hypothesis that it's actually self-regulation that helps folks increase their cognitive activity, which obviously is good for the brain and their health. But we're testing that mechanism, and we identified that mechanism through the Science of Behavior Change framework, which is another NIH initiative that the National Institute on Aging likes to use. And if you check out the Science of Behavior Change website, you'll see there's a whole list of mechanisms, there's a whole list of measures that you can use to test those mechanisms, and think about your conceptual model of how you start with the music-based intervention where the outcome is increasing cognitive activity, but through the mechanism of self-regulation is just one example. Hopefully that helps.
We also have another question here. How many projects will be potentially funded under the call?
Great question. So for this year, we anticipate funding up to 2 pilot applications. Last year, we funded 3, but that was because it's straddled over 2 years. So we anticipate funding up to 2.
And then we also have a question. I saw that there is a consultation session available, which I truly appreciate. Would it be possible for me to register or submit in early September?
So actually, sorry about the confusion. That consultation that we've been advertising is actually if you're going to apply to the NIH directly for a larger grant. And I know that was a little confusing. So let's say you finish your pilot grant and then now you want to apply to the National Institute on Aging for an R01. That's the kind of time that you would use the consultation with one of us at the MDRN. So I just want to clarify that. That would make sense. It's not soon enough to get a consultation and then submit by November. But this would be for your larger grant. Any other tips, Melita, or Julian was involved in our first round of organization of the review panel, and definitely make sure you include all the information on the cover letter so we don't have to reach out and get that additional information. Make sure you stay within that 6-page limit for those sections. And make sure in your budget that you also justify each of the costs. And it's a simplified budget. So hopefully it'll make it easier for you to fill that out. But as you might expect, it's important to justify all the expenses.
And there was a question earlier about the availability of these slides, if they're going to be available. So just to kind of reiterate, this webinar is being recorded. So it will be on our YouTube page in the next couple, maybe day or two.
And the slides will be on our website.
Question just came in. 3 projects were selected last year. How many projects were presented?
We generally don't share that information. The NIH typically doesn't, and so we've been advised not to share the actual number that we get. But we had 3 strong applications, and we just had our first meeting with all of them today. And if you go to our website, underneath collaborators and partners, you can see who those applicants were and who those awardees were. Actually, I can share that with you right now. You can read a little bit about their projects. I'll put this, can you put it in the Q&A? Let's see, or can I put it in the chat? Will the chat work, Julian?
It should, as long as you're sending it to all the attendees. Yeah, it should work.
It looks like hosts and panelists. Let's see, everyone, here we go. Okay, so check out the awardees, Dr. Asal Habibi, Dr. Sarah Hennessy, Dr. Borna Kapoor, pardon me, and Dr. Lou Awad. We'll get those summaries up soon. We've been nudging them to get their summaries, but so far we have 2 of the 3 pilot awardees on that website. And the other, oh, go ahead, Julian.
So we have another question. We have time for that.
Terrific.
Would you advise incorporating additional outcomes into the ongoing study, considering that this is a 1-year pilot rather than an entirely new project?
So that's a great question. Again, you have to carve out a very specific mechanistic hypothesis from an ongoing study. And it has to be clear that you're not what we call double dipping, right? So if you're already looking at a mechanistic hypothesis, you wouldn't just be able to put additional money towards that. But if you carved out something very specific, yes, that would be okay. But be sure you're very clear about, which project's goals and what this pilot are unique, because this should just fund a unique aspect. And again, you want to think about matching the budget to the scope of the project, right? So there's this wonderful balance in thinking about pilot studies that also has to be feasible, which is not always simple. Any other questions? It's great to see you all here. I'm going to put a link to the directory, and if you don't already have a link, a profile in a directory, please create one. And the actual details about the pilot program are also on our website here. And as I mentioned, there was resources about the NIH stage model, the science of behavior change. Please check that out, and we will have some additional webinar links soon about mechanistic studies. There was just a recent one done by the University of Minnesota that was terrific. I see one more question, or is that one that are we good?
I think we're good. Lauren said just thanks for the opportunity.
Thank you all for being here. And thank you, Melita and Julian. Again, this webinar is being recorded and will be on our YouTube page, and the slides will also, a link to them will somehow be added to our website. Thanks everybody for being here. Have a great day.